Life has many choices.
I spend a lot of time at home.
Today, Lori Falsing chose to leave her house.
I usually don't leave if I don't have to.
For Lori, it was a difficult choice to make.
I have agoraphobia. Agoraphobia is fear of going out and being in public with people. If I leave with my caregiver, or I don't leave.
Having such extreme anxiety, the presence of Lori's caregiver makes getting out a little easier.
I could not survive without her. She makes my life bearable.
Lori has other ailments.
I have Crohn's disease, fibromyalgia, rheumatoid arthritis.
One of Lori's many prescriptions is sent to her home through a mail-order pharmacy.
With home delivery, filling prescriptions for most maintenance medications, those you take regularly, is as easy as making your other online purchases.
I'm sure for some people, the mail order is the best way for them. Where I live, it's not safe. I've had my entire mailbox ripped off the side of the house, and they took all the mail that was in it, so it's not safe to deliver a medication, of any kind.
Instead of Lori paying out of pocket to go to a local pharmacy, Lori's insurance company covers her prescription cost at a mail order pharmacy, a decision made by what's called a pharmacy benefit manager.
They are the contracted entity that your health plan contracts with to control and manage your medications that you receive and fill.
Dr. Jenny Arnold is the CEO of the Washington State Pharmacy Association. According to the National Association of Insurance Commissioners, there are 66 pharmacy benefit managers across the U.S. They control 89% of the market and serve 270 million Americans.
More and more pharmacy benefit managers own the mail order pharmacies, own the specialty pharmacies, and now require patients to use their pharmacies or highly incentivize patients to use their pharmacies.
The incentive is a significantly lower copay when using a mail order pharmacy. This form of vertical integration has a negative impact on local pharmacies, like Kirk's Pharmacy in Puyallup.
As a community pharmacy, most people think of us just as dispensing medications, but being a pharmacist is significantly more.
Dr. Andrew Hines and his father own this community pharmacy.
All right, perfect. I'll have April meet you right up front.
He says they're working to get people tested for and vaccinated against COVID-19.
Kirk's Pharmacy was the second single highest vaccine giver in our county.
We have something to pick up.
He says some of their customers whose insurance plan suggests a mail order pharmacy are now going that route, which takes away from his business.
You're going to pay, sometimes 3, 4, 10 times more if you go to a pharmacy that you choose versus getting it from a mail order pharmacy. Morning, Lori. How are you today?
I'm good. How are you?
Excellent.
Lori gets all but one of her medications from Kirk's. Dr. Arnold says a bipartisan group of lawmakers believe Washingtonians should be able to choose for themselves to receive the prescriptions either in the mail or in person.
The Washington legislature introduced House Bill 1813 this year, which gives patients the choice to choose between a mail order pharmacy and their community pharmacy. It prohibits the pharmacy benefit plans from requiring their own mail order pharmacies be used by patients.
If passed, the result would let patients choose how they receive their prescriptions.
We're not anti-mail order medications. I get some medications mail ordered. It's giving the patients the choice of where they get that care.
All Lori cares about is having that choice.
Giving people the option to choose for themselves where they get their medication is just as important as having an option for anything else. Choosing who your doctor is, who your spouse is, who your friends are. Those are all things that are very personal and should be only made by you, not some company.
We reached out to the group that represents pharmacy benefit managers across the country, and we asked them about that pending bill in Olympia. They responded to us saying, in part, that if passed, this bill would raise prescription drug costs. That bill is currently passed the House, and it is now making its way through the Senate. We'll keep you in the loop on what happens. In Seattle, Steve Solis, King 5 News.